How do I
Okay.
stop this?
हेलो गुड इवनिंग एवरीवन एंड आज के इस सेशन में आप सभी का बहुत बहुत स्वागत है। और इस सीरीज़ में जहाँ पे हम लोग सर्वाइवर्स को इनवाइट करते हैं, डॉक्टर्स को इनवाइट करते हैं, और हम लोगों का जो ये एम है वो किसी भी तरह से ये एम है कि हम किस तरह से कैंसर पेशेंट्स और केयर गिवर को ज़्यादा से ज़्यादा सपोर्ट प्रोवाइड कर पाएँ, हेल्प कर पाएँ। उन्हीं सीरीज़ में आज हमारे साथ हैं रूपा आनंद जी। एंड इससे पहले कि मैं उनके बारे में इंट्रोडक्शन दूँ, स्मॉल इंट्रोडक्शन अबाउट आवर ग्रुप। सो ये जो कैंसर सपोर्ट इन इंडिया जो हमारा ग्रुप है, ये अराउंड 2015 के आसपास सावन विश्वकर्मा ने स्टार्ट किया था। एंड दिस इज़ ऑल्सो वन ऑफ द ग्रुप जहाँ पे ऑल्दो इट स्टार्टेड फेसबुक ग्रुप, बट देन much more than just an emotional support. People are trying to help each other in all the way, whether those are the medical queries या फिर किसी के कुछ experiences रहे हों अच्छे या बुरे। हर वे में हम लोग कोशिश करते हैं इस जर्नी में एक दूसरे के साथ कैसे रहें। और आज इसके बारे में ज़्यादा बात ना करते हैं, आई विल जस्ट इमीडिएटली जंप ऑन टुडेज स्पीकर रूपा जी। रूपा जी इज़ ऑल्सो member of our group, which is registered as NGO, and he has been a mentor for us and always guiding and helping us in all the ways. Thank you so much for your support, Rupa ji, and थैंक यू सो मच। एंड के बारे में हम लोग जानेंगे अभी आगे के इस 1 आवर के सेशन में। सो रूपा जी हैज़ एज रिक्वेस्टेड, शी हैज सेड कि उनको थोड़ा सा डिफिकल्टी रहेगा टू do this session in a whole one flow. So what we are doing is, in some of the cases what we do is we make it very interactive. हम लोग उनसे questions पूछेंगे and she will be replying based on what we are asking. And at any point of time, Rupa ji, if you feel you are not comfortable, you need some you want to stop for some time, that's perfectly fine. We totally understand that. So Rupa ji is a is very cool person, like आप लोग जानेंगे, she's very very graceful, and I personally admire her a lot. She had been an English literature student and काफ़ी लर्निंग है। आई मीन बहुत सारी चीज़ें हैं, ऑथर हैं, राइटर हैं, पोएट हैं, हम उनके बारे में जानेंगे। बट उससे पहले आई मीन जो छोटा सा चीज़ है वो, रूपा जी, फर्स्ट क्वेश्चन मेरी तरफ से ये है कि आप मतलब ज़्यादा डिटेल में जाने की ज़रूरत नहीं है, बट इन फ्यू लाइन्स आप थोड़ा सा बताएंगे हाउ योर लाइफ वॉज इम्पैक्टेड कैंसर।
First, I'll do Namaste, Hari Om, good evening, good morning, everywhere, all over the world, all over internationally, and in India. Actually, cancer arrived just in the middle of COVID. I discovered a lump in my breast, in my left breast. I think it was 2nd or 4th of July, and there was no emotional response. I've been a spiritual student, so I just accepted it. It was just something which happened. Maybe I don't know what it was, but it was just accepted. So I told my husband and I told my daughter, and they just looked at me and they accepted it too. And then of course we got down to कि क्या करना है, कहाँ जाना है. And like I said, middle of COVID, this was July 2nd or 4th of 2020 when the first wave was on. So we went to a mammograph center. I don't know why we went there really, to just get the to get the mammography done. And when she saw the mammography, she called my daughter Aradhana and said that I'd like to call, there is a path lab here, I think Dr. Dangs, he's very famous. So can I call somebody from Dangs? So she said, "Haan, theek hai, kya hua hai?" She said, "Not looking good." So the gentleman, then she signed the requisite papers, and the technician or a doctor came, I think, from Dr. Dangs, and he took what is called a fine FNA, fine needle aspiration. So, and then after that, it just flowed, wo kiya, and then I remember having this small notebook. I think I still have it, like that flip. And I said, "Ab kya karna hai?" Suspecting cancer or whatever. So where do we go? What do we do? So made a list. Actually, I made a list of all the oncologists and all the surgeons just sitting there on the first day. Then to cut a long story short, chemo started. Of course, you had to go for your tests, and I couldn't take second opinions. I didn't hide it from my friends. I picked up the phone. I don't remember, but I spoke to a few of my friends. And I'm a spiritual student, so I have a spiritual umbrella, and all of them sort of got into action. Uh, Eventually, I got my uh, everything done at Max. So somebody said, I'm going to phone up Dr. Harit. I told my brother. He said, Rajiv Gandhi Center. Apparently, the chairman there was a school friend of my younger brother's. So they said, वहां जाओ, इधर जाओ, उधर जाओ. अच्छा, वो सारी लिस्टें विस्टें बनाई, किताबें खरीदी, notebooks खरीदे. So I went for testing to Rajiv Gandhi Center. It was fine. And then again, it flowed. We sat there, we didn't know what carboplatin, this, that, wo kya chemotherapy drugs. I couldn't even pronounce the names. We just opened the notebook and I kept on saying, फिर से बोलो, फिर से बोलो. So my daughter says, कि mother, we can go home and Google it. अभी उसको लिख दो, whatever is coming to your, just join the letters and just write it and let's get on with it. So I don't know whether I went once or twice, and I met the senior oncologist. There was a very young chap, I think his name was Pankaj something. He said, ma'am, can we just do some tests? I think they did a PET scan and they did what is called a core cut biopsy, maybe after a day or two. So all my testing was done there. And then, of course, came the crux ke, ab kisko chunna hai? Which surgeon do we go to? What do we do? Remember, again, it was middle of COVID. We were all wearing cotton masks and ajib masks. And second opinions were really not on the tray, were not up for offer. So I didn't really go for a second opinion, not that I regret it. So I went with Max and I went with Dr. Harit. And another friend of mine, again, why I keep saying this, it was again my spiritual umbrella which stood up. And somebody said, I've already got you the appointment. I said, but why? I haven't received my reports. They said, you go. So I hesitated. I messaged Dr. Harit. I said, report nahi aayi hai in English. So he said, no, just come and meet me. So I went and met him. Then Dr. Nitesh Rohatgi, who's the oncologist, he was another friends. They're my friends again. So they said, उधर भी हो गया है. I said, अच्छा, उधर भी चले जाते हैं. कुछ अकल नहीं, कुछ समझ नहीं, बैठ गए. My one younger daughter is in Canada. So I asked Dr. Nitesh, I said, can I take a video? कुछ समझ तो आने नहीं थी. कौन repeat करेगा, for all the family members. Video लो, पूछो और दिखा दो भाई, ये बोल रहे हैं. So that was done. And anyway, I took the decision. My brother asked my daughter, where are you comfortable with in Delhi? So she said, look, I can't take her to Rajiv Gandhi. It's too far. It's in Rohini. I would prefer to go to Saket and Max. Fine. So we opted for that. And then I started my treatment. Dr. Nitesh is a very young, very savvy, very smart, very forward-looking, I must compliment him, oncologist. And he does a lot of research. And he said, he answered all the questions. And he said, we need to start as soon as possible. I, of course, had pressure from my brother saying, operation karao, wo purane khyalat ke, he's 12 years older to me, where cancer meant surgery first. Now, we know that it is chemotherapy, Piyush, like neoadjuvant, Oh, he couldn't understand that. So finally, I had to have this full discussion that, look, things have changed, times have changed. So I went, and my first chemo was, I think, on the 27th or something. So within 20 days, I was already into the first chemo. And I've taken about 17 cycles. I didn't have much of a response, though my daughter says you were a bit irritable and moody and blah, 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 but that was fine. And they did change the medicine in between. I think they changed it to paclitaxel, which is a little more conducive to, to side effects. And I sailed through that. And then, of course, was the thing, कि वो डालेंगे कैसे, वो pick line में. I had a cousin, a first cousin or a nephew or something, and he had pancreatic cancer, and he said, वो पोट मत डालना, पोट मत डालना. पोट क्या चीज होती है, वो पोट डालते हैं आर्टरी में और वेन में. I said, अच्छा ठीक है. So I tell Nitesh, I said, पोट नहीं डालना है. So, but he's very sweet. He said, fine, don't put a pot. What do you want to put? Put a pick line. So pick line kiya, वो सब किया. Now, of course, I know much better, and I say pot is much better. But वो pick line यहाँ डाला, उसको कैसे cover करते हैं, वो नाते कैसे हैं, so that it doesn't get wet, and all that drama happened. And it's a long story, but that happened. And then I had my first sign actually was a swollen arm. Let me take you further. Before the discovery of the lump, my hand was swollen. This hand was swollen. And again, it was COVID times. There was no staff, and I used to do all my gardening. So I thought, कुछ मच्छर वच्छर काट गया है, कुछ हाथ क्यों swollen है? Went to the local doctor. after a lot of persuasion, my daughter said, "नहीं जाना है, COVID का time है, ठीक है." 1 month passed. I noticed the hand on April 30th. I went middle of May. I don't blame him. He just said, नहीं नहीं कुछ नहीं है, आपको आप मसाज कराते थे, हाँ. He never connected lymphedema or cancer or anything. So came back home. So they had obviously gone to the lymph nodes. Anyway, my surgery then was to go jump forward was on November 30th. Am I going too fast for all of you? Is it okay?
Yeah, it's
So
fine.
then the surgery took place in November 30th, which was a radical
ये वन
removal.
रिक्वेस्ट
हाँ
रूपा जी,
जी,
थोड़ा सा
बोलिए.
हिंदी मिक्स कर दीजिए ताकि ज्यादा से ज्यादा लोगों को समझ में आए.
हाँ हाँ. So then the surgery happened end of 30th of November, and that was also fine. घर आ गए, सब कुछ हो गया. I had an old girl. You see, again, COVID times. Problem is, कौन देखेगा? My daughter flew in from Canada, and son-in-law didn't come because, you know, infection, risk of infection, everything got the house together. So that all went off very well. Then after that, what happened after that? After that was fine. I went for my walks and I started my exercises, and then I went for radiation in January 2021. I took 15 sessions. I took what I think is called the IRMT. मैंने आपको लिखा है शायद
बिल्कुल
सब.
बिल्कुल. सो
Yeah.
IMRT radiation was the I mean administrator to you.
Yes. So they took me in and she gave very nice Charu Garg, and she gave me some lessons. You know, you're supposed to breathe. So you're supposed to put your chest out so that there is space between your heart and your breast. So they give you that. Then in that space of breath, they radiate. They put the radiation. So the idea is so that there is minimal damage done to other organs. That is some technique of theirs. तो पहले वो सीखा, ये यहाँ से breathe करो, ऐसे breathe करो, उसको hold करो. I went for lessons at the hospital. So that was fine. And then radiation started. I was fine before radiation with the arm and all. Radiation didn't bother me. It was quite hilarious over there. They forgot me on the table once. भूल गए मेरे को. मैं यूं करी जा रही हूँ पागलों की तरह. No, they leave you there and there's a camera there, and then I'm saying, अरे भाई कुछ करो. So it's quite hilarious. And then solar radiation थे. Then after 15, I took a big cake for them and I said, cake खाओ, मैं नहीं आ रही हूँ. बस हो गया, बहुत हो गया. Then after that, things got a bit, by middle of February, end February, my arm went stiff. What I remember was this full thing. I couldn't open my hands. They were all tera. It was, then I started reading up. I started reading on the effects of radiation, whether you should get radiation or you shouldn't. And to this day, I still ask the same silly questions from the same old silly doctor's team, and the same, give me the same old answers. It had gone there, we needed to save your life, and one could have escaped, and radiation zaruri tha. I said, but aapne to mera sara haath ko to papad kar diya. Because you see, don't forget, these rays have an effect. So it becomes completely stiff. Then I had done some reading up, and your physiotherapists in Delhi and in India are not lymphedema experts. Most of them are tuned to orthopedic. So I found Dr. Seema Grover, got an appointment with her. She's the head of physiotherapy at Apollo, and she's a certified lymphedema expert. She met me, and after 3-4 sessions, she came to know me. And she said, it's not going to change. You have to manage it. It will improve, but it will never go away. So I'll never forget those words, straight on, flat to my face, accepted. I said, "Theek hai, karo." Then I even took my Ruby, who was my caregiver. She was my yoga teacher from the Chinmaya mission. So I said, "Tu chal wahan seekh le, kya sikhate hain bhai, wo sare pure bandage, everything." And I used to scream when she used to kind of straighten my arm out. And I went. What I want to tell people is that physiotherapy is very much a part of this. I had a friend who had a frozen shoulder. I'll never forget her words. She said, "Spend the money on physiotherapy, Rupa. You have to spend it." And I did. And I felt the quality of life that I enjoy now is because I listened to her and I went. For about 2 years, 2021-22 मैं गई लगातार. सुबह 8 बजे जाती थी, झल्लों की तरह पूरा बैग पैक करके, पूरे बैंडेज लगा लगू के चिल्लाती थी वहां पर. वो शी यूज्ड टू से वेट वेट, सीधा करते थे, उल्टा करते थे. उनके सारे इंटर्न्स हैं, they all come and tell you ये एक्सरसाइज करो, वॉल एक्सरसाइज करो. So all that was done. But diligently, I did it for about 2.5 years. Now I don't bother. I wear these motorcycle sleeves, which Savita wears also. I said, "Ah, ho gaya boss." And I think the body listens to intuition. As you age, I don't want to wear that anymore. I think the lymph has found its way. And if the arm is a little more whiter and a little more fatter than the other arm, fair enough. It doesn't bother me. I also did a lot of counseling for women, a lot of women from different economic backgrounds at Apollo. Women are very attached to their bodies. They are very vain. They don't want to wear those things, the bandages. And Seema ji used to feel very frustrated. So I used to tell them, I said, पहन लो, साड़ी पहन लो, अच्छे चमको धमक जो क्या है वो पहन लो ना, and you just have to, because accept it. नहीं. So that was quite an interesting part of my life. And now I think I've talked enough. अभी कोई question?
Yeah. नहीं नहीं हम पूछेंगे questions. So
So I
thanks
think
for
that
sharing.
that
Yeah.
went on, and after that, then I took to writing. Actually, that is what really saved me. Uh, Being an English literature student, I used to write poetry, and I used to send it to the Chinmay Mission publications, to the spiritual organizations. Some of them of Maharishi Ramana Maharishi
I
Ramana.
think Rupa ji will just take a
Yeah.
halt. I will take a pause here because we just heard your journey with cancer, and after that the challenges you have faced.
Yes.
So uh, we will go to your other journey as well, the spirituality, how it has given you the strength and everything. But उससे पहले, when you got to know, so this is my question, and probably everyone else who is listening, and if you have any questions, please raise your hand, and let's make it as interactive as possible. So when you heard it for the first time, you have been, it's confirmed that you have a cancer. What was your, like, the first reaction? You
Nothing.
know,
I said it very clearly. Nothing. It was just acceptance. It was
so
like
I mean the
It was
acceptance
like
came.
गाड़ी में पेट्रोल खत्म होनी है तो पेट्रोल के स्टेशन पर जाके पेट्रोल भराओगे ना गाड़ी चलाने के लिए.
Exactly.
As simple as that. It's very difficult to explain this, but that was exactly what it was.
Okay, I mean,
Because
which is very, very a different thing which we are hearing, because most of the patient they go to denial, ki like, how come it happened to us? There are so many complaints. For example, in your case, what we heard is कि आपका एक डेढ़ महीने तक you couldn't meet, right? Because your hand was already swollen and you were suspecting that something is not right. So and see, we have seen people like complaining, and they complain like why it didn't go earlier, why it was not detected earlier, and then acceptance come at very later stage.
yes.
But I'm glad that happened. And we also hear कि आपका family support काफी था, your
Yeah, I
daughters and
think in a quiet way, they didn't go into any drama. I don't think my husband ever realized it was the left breast or the right breast. I still joke about it. And
which is
ask, yeah, I mean, I don't know what happened. And then my daughter said, in fact, she forbade him from coming to the hospital. She said, I can handle one mother, but I cannot handle two children. Not possible. So you sit at home and let me take mother and do whatever is required. So, which is fine. And the younger daughter also came. But like I said, it's a very strange, maybe I've been trained in Vedant to accept a situation. It's very difficult to explain this to I cannot explain it. And I don't think anybody can understand it. So perhaps पहले साधना पिछले जन्मों ने में की होगी तो ये acceptance आ गई. It was just there. And then like I said, I just flowed from one step to another, to the third, to went to Rajiv Gandhi. My daughter is saying, credit card hai, हाँ है, ये payment करनी है, कर दो, pet send करना है. And different people I spoke to, like a friend from Vedanta said, Rupa, you need to get a PET scan. So I had a little things in my head that these things were needed. So I did all that. And I don't regret anything really. So looking back, everything went off fine. In fact, my daughter wanted the other breast removed. I also got what is called a gene test. I think आपको बताया था, and I think I got two markers, but not the one which is transferred to the daughters. And both these chaps said, no, we'll have to send your mother for psychological testing. They said she doesn't need any psychological testing. When they're saying to
she's
take out
smart
everything,
enough.
just take it off.
Or
So even today I joke because I personally feel I won't take the lady's name. She's very sweet. I don't know her. She phoned me up. She said, Rupa, I'm very small. I'm very short. She ran away from 3 tables. This is humor in Delhi. She ran away from AIMS. She ran away from some other Harith's also table. And then she went finally to another hospital and she said, Dono nikalo. And they said, nikal diya. They actually took it out. And she said, I'm very happy because, you're slim, you're petite, you can wear a t-shirt, you can do anything. I mean, now you're kind of lopsided. I write poetry. I've got one poem which has really made me lopsided. So, these are the jokes that you have. And, but of course, the team said, we do not remove a body part which is fully functional unless you're really very serious, like Angelina Jolie, but she had tested for that famous BRCA gene. So it was okay, but my daughter said, "नहीं, everything uterus भी निकालो, ये सब कुछ निकालो, सारे body parts, but सब कुछ निकालो." So we had those kind of joking sessions, and but
Yeah.
it went quite fine, and radiation was also fine. After radiation started the hard part, where you got to get your quality of life back in terms of lymphedema, and I still learn. It is still, your body is still stiff, and you do have a lot of, the side effects are there.
Yes.
Like
Yes.
your feet swell up, they're all black, and then you get a lot of neuropathy. I still have neuropathy, and you have those rollers, those wooden rollers. So, but you learn to do all that. So, other than this, I think it's a normal cancer journey, like for all of you or for anybody.
Yes. Yes. Thanks for sharing that. So, anybody
Have
who
a
has any
yeah, I do
specific question? Yeah. Yeah. Maya, please.
do have a question. So one, I think I know you're calling it a normal cancer journey, but no cancer journeys.
Oh, I can't hear you. I think you're muted, Anaka. I think you're muted.
No,
Yeah. Yeah.
never mind.
Yeah.
One second.
No, you're muted.
So we're just trying to work out the mechanics because there's an echo coming, right? Since we are sitting close by. Sorry about that. So I'll go
Amel
off
ji, you
mute
can,
after my
Bimal bhai, you
question.
can mute yourself, तो इको नहीं होगा.
Just
नहीं तो आप mute कर लीजिए, इको नहीं
I
होगा.
think this is fine. So I think
Oh, this is fine. Yeah.
I think thank you for sharing. No cancer journey is normal. So I think whatever your unique perspective is, we're definitely learning from that. I think one. As you were talking about this, you seem to go from strength to strength, right? Even through your journey, you didn't really have the emotional downs that a lot of us went through when we were either caregivers or people that are going through it. So if you had to tell us how we can get that strength, what is it? What is your say? How do we get to that level of strength?
I think the answer is to get into a spiritual life because it takes you away from your identification with your own body. I'm putting it very straightforward. It teaches you from the highest perspective that you're not the body. And I think I was very clear on that if I'm not the body, then I watch my body. I see the changes coming. And I also know that there are normally 6 changes, through growth and decay and death and everything. We all know that. So I think that awareness of that is very powerful. And that is only what our own Shastras, our own spiritual scientists, I call them, the rishis have taught us, which it's not religious mumbo jumbo. It's telling you a way of life, a scientific way of life. So I think my attention was already not on my body. It was away from the body. So what the body suffered or went through really didn't matter. I don't know how to again explain this to non-spiritual people, but since you asked that question, I'm trying to address it as best as I can. It's strange. I'm a strange person, I think, in that perspective. So you get that strength, like just you're not the body. So what happens to the body? How does it matter to you? Because of your attachments to your body and you want to live forever, nobody actually really thinks. मनुष्य सोचता नहीं है ना ये, कभी सोचता ही नहीं है. आप सोचो, कुछ ना कुछ तो होगा ही ना. It's like a toaster. Some spark is going to go somewhere. And this is what you call nimit. It's a way. An illness will happen for many reasons. We don't know those reasons. We may carry it in our DNA. There are sources which say we carry family trauma, past trauma in our DNA. Cancer is part of it. Some of it says that it is due to the environmental changes. A lot of people say it's due to the mutation in wheat that we eat. A lot of it is due to stress. So you have because your body is an organic body. It's not something which is, it's very difficult to explain this in this kind of terms. So I understand when people say, no, cancer ka to, like even when I was talking to Krishna about matrimony and all, I think the West are far more attuned to chronic illnesses, to accepting them, to coping with them, to caregiving for them. They're more open to it. They're more open to get out of a relationship if it is not working due to cancer or a chronic illness. And India has this whole double standards, which I'm trying to now kind of, bring to light. One of my journeys post-cancer is bringing that to light. I know I've digressed quite a bit, but I hope I've answered your question.
You did, and
I think you have been very strong also. I've followed Mehul's, I'm sorry, I don't know the details because I don't tend to remember to say, I just remember it. But I think both of you have been very strong and very, very supportive of each other. And I think I see that same acceptance, that same strength and the same positivity and the same results which come from that positivity, because you can manifest your outcome. I don't know the name of all those books that nowadays these foreigners bolte na manifest karo to wahi hota hai. But you have to believe in it. You have to before you go to sleep. There are a lot of these courses, wo power of home, power of this, wo sab change karke aapko present kar dete hain. But the same thing is that the universe listens, the body listens, every cell of yours is listening. It's age old. It will listen to you. But a negative thought has far more power than a positive one. You have one negative thought, aap to mar gaye. वो तो आपको डुबो के ही रखेगा. To get a positive thought for most people is very difficult. And you can imagine if you have a lot of positive thoughts, then it nullifies the effect of negative. This is scientifically been proven also by many books written on the power of on consciousness levels. They calibrate it that on positive thinking and on negative thinking. But you can't teach this. It just I see it in both of you. I see it in a lot of people. I see it in a lot of people on CSI.
I think the interesting thing is I'm not spiritual, and so sometimes I wonder if spirituality would have made it easier for me than not.
I think the right spiritual understanding, which is that you're not the body, that is the highest sense of understanding. Where does your identification lie? Does it lie with the body or does it lie beyond the body? So if you identify, it's not that Bhagavan is not sitting there on some tree with a long flowing beard and saying, Aja bhai. No. That's a very, kind of a misnomer and a misunderstanding. It's when you read, you ask questions from your teacher, you study, you do sadhana, you meditate, you finally have some intuitive understanding and you operate at that intuitive level. And you don't operate from a level of, that's why they say, that then when a sage looks at the world and a master looks at the world, he says, Kya pagalpan nahi, to sab pagal hai, ye to soye bhai hai. What they mean is that they haven't really woken up to who they really are. So it doesn't matter because we live many lives. So if this is one lifetime, fair enough. If cancer has come, it's okay. I can't do anything about it. And I'm also, okay, forget about spirituality. I'm also a person, I'm a problem resolver, strangely enough. कोई प्रॉब्लम आई है तो उसको रिजॉल्व करना है, किसी तरह रिजॉल्व करना है, कुछ तो जुगाड़ करना है, So that part of me also came up, which I think is there in a lot of us. Let's see now what we can do. And then of course there is I had some friends from the breast cancer circuit. She couldn't accept it. She couldn't accept it at all. I mean, it was just, so that whole non-acceptance, the body also listens to that non-acceptance, Amata. It listens to it, then it doesn't heal. You don't heal so much. I mean, like again, Mehul, I think 4th stage, Mehul, yours was?
Yeah,
Third
yeah.
stage?
Stage 4, yeah.
So then you see that, I mean, I see it in him. So, and also the way he's also spoken about the way his mom looked after him. And of course, you too, but, so I don't know, we may be having those traits from our past birth. I don't know. But I think everyone, spiritual or non-spiritual, goes through these phases. of positivity, of negativity. Like I was telling Savita, I said, I've actually gone through a stage of a little bit of a dump in the last month for no rhyme or reason. So it's not that you're all the time upbeat. You're not. As age catches on, everything, you do have your moments of, that what is happening and stuff like that. And then you get out. You go for a walk. Nature is a very big healer. It has been stated, nature, always go out, go and sit out in the open. And this particular lady whom I know, she never would sit out in the open. She would just sit in an AC room, band, 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 वो टीवी 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 क्या दिख रहा है उसमें फिर आप वही वही चीजें आपके दिमाग में जाते हैं ना, वो सास बहू सीरियल और whatever, वो दिमाग फिर that whole thing, vibration enters you. So that you know,
And I also feel ki sometimes we are, internally we are spiritual. We just don't know that we are
yes,
spiritual because we
yes,
don't know the definition of being spiritual.
yeah,
It just so this positive thoughts and positivity and everything, it's all linked once we start understanding ki hai kya, this all spirituality bolte किसे हैं, then we actually go back and see that ये सारी चीजें लिंक की थी, हम लोग ये सब चीजें कहीं ना कहीं कर रहे थे, right? So maybe that's how even I felt, and that I think most of the cancer patient being positive, and हम लोग जब बोलते हैं ना positive रहो, तो वो कहीं ना कहीं से you draw your strength, and वो
yes,
spirituality होती है, हमें पता नहीं होता है, that's a different thing altogether, but yes, I also believe in that. And at this moment I would like to share one incident, I think I'm taking away, but ये हुआ है कि जब मेरी फर्स्ट कीमो थी, तो मैं इतना डर के वो बोल रही थी कि हे भगवान, ये तो इट्स अ पॉइजन विच इज़ गोइंग इन माई बॉडी, और इतना नेगेटिव थी, एंड आई हैड अ ह्यूज साइड इफेक्ट, बट सेकेंड थर्ड आते आते आई वाज लाइक नो, दिस इज सच आई मीन इट्स गोइंग टू सेव माई लाइफ, संजीवनी बूटी है, ये है वो, और उसके बाद थोड़ा ईजी हो गया. सो दैट पॉजिटिव नेगेटिव का आई थिंक आई अंडरस्टैंड ये सब चीज़ है. सो नेक्स्ट क्वेश्चन, आई मीन इफ एनीबडी हैज़ क्वेश्चन. अच्छा, मेहुल भाई को है, हाँ.
Yeah. And I just want to add, like, I don't have a question, but I could relate to my experience when Rupaji was talking. Like, so my life was like kind of running fast, like the job and house and everything. And suddenly I get this cancer, stage 4, and my life stops. And I believe that that is the phase when you stop and you think. Like,
yes.
ये तो गाड़ी, like रूपा जी सर की पेट्रोल भर गाड़ी तो रुक गया, अभी क्या करें? Like, and that is what that changes it changed my thought perspective, and I totally believe with Rupa ji. Like, I though Anava is not that spiritual, but I am a lot, and and this cancer made me realize that it really is there. Some power is there in the universe, in nature. Like, I started reading books on power of attraction and all that. Today, I
Yes.
100% believe it really works. So yeah, Rupaji, you're like a big school, and we've got a lot to learn from you. So I'm really
No, no,
enjoying talking to you.
no, I think I think also now I've reached a stage that, we come with some sort of our preset karmas also, and we go through our life. That is why some of us are positive, some of us are negative. That is another strange thing, So you can't tell a negative person to be positive. Arre Baba, wo kaise? I have somebody I know who's even the plant will also droop in their house. अब वो ऐसे बंदे को कैसे बनाओगे positive? It's not possible. So I think sometimes you need to just leave it. Like we have these certain rules in our CSI, in our forum also, when we say छोड़ दो, किसी को समझा नहीं सकते हो, कुछ बोल सकते हो, positive कर सकते हो, and you can also hold their hands in times of negative, when you're feeling low. So I don't know in India how much it is. I got a support from a lot of people, but I was also ghosted by a lot of people. I'll be very frank and I'll say it on a recording. People just drop you. People just drop you. So because they're there for a certain materialistic purpose, they don't know it, they're not aware of it. But the world vibrates to materialism in a sense. And there is another vibration which is intuitive. So the material walas, once they realize that isse to kuch lena dena nahi hai, so they, it's called, I didn't even know what the word ghosting was till I realized it, what it was. And in that sense, I find that we are not compassionate, we are not humane. And because our minds are more into the material world, again, I bring in the Western world. I've got friends in the Western sector whom I've not really met, but I know that a lot of them are very wonderful caregivers. They understand. They have a lot of compassion. I think it was this famous cricketer, Yuvraj Singh. I think he says, Delhi में आके तो मैं तो मर जाता हूँ. यहाँ तो मेरे को वो तो डुबो देते हैं. वो कैंसर हो गया. And he says in the West, it is like everything you can talk about it, you can walk down. I mean, I'm sure Anaga and Mehul, you will, and even perhaps a lot of other people, Krishna might testify to that. They're far more, it's more accepting. It's like, okay, come along. You want to go for a movie? I'll come with you. Here, no, no. So we really have to come out of that dark abyss, which I find. I find it a lot. I mean, there were times when I was low, there was a friend who would come over and the others said, no, they wouldn't be bothered. See, that compassion factor is not there. Compassion for another being, compassion for a dog, a cat, a bird, whatever. They're all beings. You share the planet with all the beings. You're not superior to them. So that is something which you can't teach people. So अपनी वो journey है, वो उनको करने दो. Then I realized कि करो अपनी journey, मैं अपनी journey करती हूँ.
True.
Why
So
I
we
said this
have,
is because I want people to understand that if they're finding loss in relationships or anything, it's fine. It's okay.
it's fine. I mean, that those things or those people were there for certain
Yes.
time period, and that's done. So we have more questions coming up, Rupaji. I think so. I'll take those
Oh, I'm
questions.
happy to take, okay.
Yeah, yeah. So Vikas ji, he has raised his hand. After that, Alicia, you can ask. Vikas ji, yes, आप पूछिए क्या पूछना चाहते हैं?
Uh, yeah, hello, ma'am. Hello, everyone.
Hi,
So,
Vikas.
yeah, it's really good to hear you, ma'am. So, it's giving us lots of inspiration. We are listening. My wife is also here.
I'm glad. I'm
She's
so glad.
fourth stage cancer patient.
Okay.
So, just she asked me to like what you are doing for the spirituality, like what specific things for
Okay. This is, I
spirituality.
study Advait Vedant. Advait means there's no two, you're one. But now I see two now. So you have to start somewhere. You first have to find a teacher, a good teacher, and then you have to go to him like it's written in our Shastras. And then I've been studying under Swami Nikhilananda. And I used to ask him questions on time and space, I remember. Kuch hoga purva janma. Again, I say that we all live our lives. We die. The gross body dies. Our subtle body takes another birth. I think all of us believe in that or understand it to a certain marginal level. All the Upanishads talk about it. So when you understand that, then you know that this is just one life. I mean, and we give so much importance to this life story, I can't tell you. वो शादी की, बच्चे की, ये किया, वो किया, इधर क्या, वो घर गया, वो गया, वो शहर गिर गया, वो it just goes on, and when you're dead, it's gone. Your stool sharir dies, they burn your body or they bury your body or whatever. And then your other composite, your sukshma sharir takes a new life according to the laws of the cosmic laws. I won't go into that but basically it's Advait Vedant that we are one. Where's
So, ma'am,
Vikas?
just
हाँ
one
जी.
more thing.
अब भगवत गीता उनको बोलो भगवत गीता भी सुन ले.
Based on, yeah, based on the age factor also, like she is 40, so it was more
Okay.
difficult for us to accept this thing.
Yes.
Like, it depends on the age also sometimes. Like if we cross 50, 55 or
विकास मैं एक प्रश्न पूछना चाहती हूँ. There are so many children who die.
yeah, right.
See you live so many lives. Now we feel in this lifetime, अरे पूरा जन्म तो लेने दो, मतलब पूरा जीने तो दो, 70, 80, 90 साल तक. See, these things we don't know how, we don't have the answers to that. Only some of the rishis who can, the mantra drashtas or whatever, they perhaps can answer your questions. But I do understand that, yes, from a worldly perspective, 40 is a very young age. So you asked me the question that where she can start, even if she starts lessons on the Bhagavad Gita, she might be able to understand what they are trying to tell you, what Bhagavan Krishna is trying to tell you. You see his own life. It was full of strife. What a dead life he was asked to be killed.
Right.
So you study that only and वो क्या किधर से उधर भागे ये किया वो किया. You see all these people's lives. It's not easy. So what they're trying to say is that life on earth is not easy. It's never been easy and it never will be easy. So to answer your question, let us start with Bhagavad Gita. It's nice. It gives you a lot of guidance. It gives you a lot of understanding. It gives you a lot of bhakti. So,
Mhm.
सब कुछ मिला के कुछ ना कुछ तो imbibe करेगी. She will definitely learn something.
I agree.
Yeah,
I
good.
do agree that. And I think हम लोग को एक very not a completely spiritual but कुछ holistic way में कुछ something we can have this session, and we will think about it, because I mean we have seen and witnessed many people hold on the spirituality aspect, right? I have met people in hospitals during counseling, and जब उनसे बात करी थी तो वो लोग बोलते थे कि आई मीन जो रूपा जी जो आप कह रहे हैं ना कि हमारा जैसे एक पेशेंट से मिले मिले उन्होंने मुझे कहा कि मेरा इस जीवन में ये रोल था, अभी वो रोल ख़त्म हो गया, इसमें दुखी होने की क्या बात है.
Yes.
आई मीन इट वाज
Yes.
सच अ प्रोफाउंड थिंग, बिकॉज हम लोग सिर्फ बोलते हैं बट उसको एक्सपीरियंस करके उसको मतलब सुनना अलग है, बट वो आप रियल में उसको क्या कैसे समझ के कैसे उसको करते हैं. आई मीन दैट्स वेरी डिफरेंट. So, I mean, everyone has their own way to hold on it, to have this understanding, the positive thinking, negative thinking, then Advait, Ved, the Gita, Bhagavad. There are so many things that I think could, we can start with something and we'll see if that
Actually,
helps.
a lot of when I went to meet Seema ji in Apollo, they were doing something, I don't remember the names, and I was quite surprised that even hospitals have understood that it's not necessarily just medical allopathic science which is going to cure you. Your cells are listening, they're beating to another rhythm in the cosmos. So she had brought in, of course, the owners of Apollo had brought in some meditation people, I think it was. Then even Max also calls in, I think, Shivani from the Brahma Kumaris to give lectures very regularly. So it's not that the hospitals have realized
Yes,
finally,
yes,
yes,
yes, yes.
that it's not just there, ye pee lo, wo kar lo, Taxol dal lo, ye kar lo, re baba.
और
So,
हमारा जो सीमा जी के साथ सेशन हुआ था पैलेटिव केयर, राइट? सो शी ऑल्सो टॉक्ड अबाउट दिस, you
yes,
know
yes.
uh, so it's important. Anyhow, we'll just think, and we'll see like how we can have such session maybe going forward, right?
Yeah,
And
something how to deal with life
yes,
stresses.
yes,
This is a stress, this is a crossroad you've come. And we all face crossroads, no? At some point,
yeah.
we face material crossroads. I remember there's another, I don't know, remember names. I think he became also some kind of a teacher. He's a Christian Fanan. Pata nahi kya naam hai. He lost all his money. He said, I lost all my money. I was sitting in New York, I didn't have a penny. I was looking into the bank and he thought, hello. So he started laughing. You see that what he depended on, all that money, that was all gone. And then I think he had a back problem or something, and he came from a very rich, well-to-do family. There is some story behind it, and then he became a healer. He went to the Himalayas, and he eventually became a. So there are a lot of stories. There are a lot of real. I mean, these are authentic people. So
I
from
think
that,
one more question. Alicia is waiting. Alicia, please go ahead and ask your question.
hi,
Yeah, thank
Alicia.
you. Good evening, ma'am, and good evening, everyone.
Hi, Alicia.
Ma'am, I have two questions.
Okay.
One is related to the social aspect of this journey,
Okay.
and another one is related to the healthcare system.
All right.
So, you have talked about the society, you have talked about ghosting.
Okay.
So, just adding to that, I want to know as a society, when we get to know about someone suffering from this disease, we often become compassionate towards them or we start to ignore them. So, from your experience, what do you think the society can do to just ease their journey a little bit? Like if we start to become compassionate towards them, I have seen that they start feeling like victims, which is again not a good thing to do. So that is a little confusing. Like, how should we act to them? How should we behave with them in order to make their journey smooth and also to tell them that we are there for you?
I think compassion means being able to walk in their shoes. It's a part of empathy. So I think you need to be there for them. And it is also relative to the person you're speaking about. Like suppose if it's Alicia, your close friend, and she's suffering from cancer, or she suddenly had, so you could phone her up, you can ask her. I think that's important. To me, that was important. I had 2, 3 of my friends who didn't bother to ask, and later on they got blasted by me. I'm sorry. I said, you never phoned up. I said, you had family members who had cancer. I used to come and visit them, but they said, we weren't too sure how you would take it. I said, why? That means you don't know me at all. In 20 years, you haven't understood. You could have picked up the phone. You could have said, hi, how are you doing? I mean, I'm that sort of a person. So I don't think this is right. Victim of what? I think the very fact that you've used the word victim, you have to remove the word victim from the victim. You're not a victim.
Right,
You're not a victim. She's not a victim. I'm not a victim. Nobody on this channel is a victim.
right,
We are
ma'am.
just facing an illness. Yesterday, it was diabetes. Before that, it was brain strokes. Before that, it was heart attacks, up cancer. But this cancer word is kind of, in Indian, terminology, it's like gone berserk. It's like people have just, they don't understand it. It's an Asian mindset. It's an Indian mindset. I don't know how to explain that. I mean, maybe sociologists or some other people can explain it better, but I don't know. And you can always go and visit. You can go and sit and have a cup of tea. You can take the person for a movie. You can take the person out. You can go for a walk. You can do so many things with that person. You can lift that person's spirits. You can say, can I take you for the next chemo? You know, in extreme cases, sometimes there's a lot of stress on a caregiver, on a family caregiver. So you're just helping out. You've got an ear. How can you not be compassionate? I mean, I pick up birds who've been hit to, I bury squirrels, I pick up birds, I look after them, but cats, dogs, everybody. It's just, you're just taught that put the attention away from your own body to help somebody else who's in suffering. I don't know if I've answered your question, Alicia.
You exactly did, ma'am. Thank you so much.
Okay.
And ma'am, as you have said that cancer itself, the word is so scary. I was actually talking to some people and they were telling me that the day we start normalizing the discussions about it will
Yes.
be the day when people will start taking it as any a bad thing that can happen to anyone.
Yes.
Anyway,
Yes.
yeah, ma'am. Can I come to my second question?
Yeah.
Yeah, ma'am, like you have navigated through this journey in India itself. So I just want to know that what were the issues that you faced in the healthcare system in context of like accessibility or infrastructure? Like what were the problems and what do you think can be done to make it a little better?
Ah, I don't know. I've not faced things in the West. I haven't been there to any hospitals, but what I understand is that India is remarkably good. What I understand from people who stepped on, both sides of the ocean. And they say, "Wahan Rupa lagta hai bahut, dur ke phool suhavne." I found a lot of compassion with my team of doctors. Yes, things are not perfect, but where are things perfect even in India or even abroad for that matter? I mean, when I used to go into the radiation department, wo pura nanga patang tum wahan baithe ho, and the sweeper is coming into the room. And my daughter is yelling her head off. I said, chup ho ja, curtain draw kar le. What do you do? Because they don't have that sense. There's so many people here. They can't follow certain systems. So I think that we need to follow certain systems. I do feel the systems need to be followed. There should be more training. We are untrainable. Frankly, we are untrained. Because we are a nation which goes by our emotions, not by our intellect. Our emotions follow our intellect. The West, the intellect takes charge and they have deep emotions. So therein lies the difference. Having said that, I think our healthcare system is one of the best in the world. Its way of operation is different because we are an Eastern society, so we operate differently. We take a lot of things for granted. We are an overpopulated country. Like I just said, radiation, wo aa gaya, theek hai, tu udhar chale ja, that sort of a thing. Sometimes the doctor is not there. Sometimes they don't bother to tell you he's gone. Those are things which are coming up. So a little bit of systematic training. I mean, I'd love to train people. I to probably tell them, baith jao, namaste karo. Oh, there are certain modalities which need to be followed. So the chalta hai attitude has to be eradicated, but you'd have to turn a blind eye. You have to get to the core of the problem, which is what I did.
I think the major difference between the West and India is that the patient to provider ratio
Yes.
in India is just way too high. The fact that we are able to care for the number of people that we are able to care for is the beauty of the Indian system. It's next to impossible, but it happens.
No,
So,
very true. And also, like I said, training. In the good old days, the nurses used to wear uniforms. Now they're not. वो कभी पता नहीं क्या वो पजामा कुर्ता पहन के आ जाते. Uniform sets you apart. It trains you. You घर आ रहे हो. I believe in some of those old. Maybe I'm just old fashioned. When I was in the hospital, they had these whole gaggle of nurses and they were talking through the whole night. Now, this would never have happened 20, 30 years ago when my parents were in hospital. अरे तू इधर आ रे तू चाय ला रे तू यहाँ बैठ रहे तू वहां बैठ रहे तू ये कर रहे तू अंदर the patient is lying there yeah trying to sleep. So these are the things which I think we need to train, where our training has gone completely. We don't have any training. We don't train them. We don't train them how to stand, how to I've had people with lambe baal. You करके the other day I went somewhere. She was going to do a scan and she had full hair open. वो घर से अपना पूरा बाल करके आई थी. तो पहले जा तो मैं बोलूंगी तू बाल बना ponytail में रख. There's a certain methodology of appearance which I think our medical healthcare owners, promoters, runners, I don't know, they don't bother about this, and I feel they need to. Like even some of my therapists used to come with all her hair. My daughter never could stand it. She said, "Mother, इसको बोलो बाल बांधने की." I said, "यार उसको करने दे." क्या बोलोगे तुम? I'm sure it's not like that in the US, Anand. I mean, I'm sure they all come with it. There's a certain decorum, a certain etiquette of behavior, of appearance. So I feel we are lacking in that, and we're going from bad to worse, unfortunately. So that is where I feel that we need to perk up, and we need to speak up gently. Aap jao, aap please baal bandh ke aao. Whatever. You get my point, because we keep taking it. And a lot of senior people have said that in all fields, not only medical healthcare, in all fields, they've all said it. The fall in our standards, I would say, in our professional standards.
I think the type of treatments that are available are exactly the same. I mean, we experienced that it was exactly the same set of drugs, the same set of regimen that was proposed, whether it would have been done in India or it was done in the US. So I think anyone that is undergoing treatment in India needs to be like rest assured that you're probably getting the same regimen that you would get elsewhere.
You are. I think it follows international protocol, if I'm not mistaken. And I don't know, maybe Piyush or somebody would know. They also have things which are not, you have this patient assistance program, which we all know when your drugs are very expensive. They give you, I think, 2 and you get 1 free and all in chemo and etc. Even for Herceptin and Perjeta, which was used for me because I was HER2 positive. And they also have lower end values, the drugs which cost less.
Yeah.
We have that, I think, at AIMS. I don't know, I'm just saying all this. So please, delete all this from the recording. So they have things in which studies, where they want to experiment on you. I got a call once and said that, "Ma'am, we'll give you this free if you become a kind of a guinea pig." I mean, they didn't use the word guinea pig, but they said, "We want to test this drug." And in all naivete, I kind of understood, and I'm asking my daughter, "Should I try it?" She said, "Are you mad? Don't be stupid now." But there are people in the lower economic sections who probably it happens all over the world.
Yeah,
Where they are
clinical trials are very standard, but I think the way they are explaining it to you
Yes.
is incorrect, because actually going through a clinical trial or even being accepted into a clinical trial is a positive step for a lot of patients where existing drugs have failed. But then
Right.
Yeah,
there
1 minute.
needs to be someone
Sorry
that
to
can. Oh, sorry.
interrupt 1 minute. So I might need to leave for some work, but yeah, Mehul is there and he'll take it forward. So I'll leave. Thank you so much, Rupa ji, and I'll
Thank you,
connect with you.
Kavita.
Yeah, thank you so much. Yeah, bye.
So for clinical trials, actually trying to find the right patients that can benefit from the clinical trial is an area of research. So we spend a lot of time trying to find the right patients that
Right.
would be willing to, not just willing candidates, but the right candidates to experiment with these drugs on. So I think the way it was explained to you made it sound like, very iffy, but actually it's like the inclusion and exclusion criteria for clinical trials is very
Right.
well defined. So that has to be explained to the patient as to,
I think,
why
Anaka,
this
you
is
brought
like-
up a very relevant point, because just to close up, I think I brought this topic up with Seema ji, the Seema Grover, my lymphedema person. And I said, I think again, it's the East and the West. I said, why don't you explain what happens in case the person does not follow lymphedema protocol? She said, Rupa, I can't. वो समझने के लिए तैयार नहीं है. They look at me like, आप बस ठीक कर दो, you know. And I think that is part of the whole problem in the East, where lack of education, and this is even with very well-educated people, you know, I don't want to, I've got personal friends who even have heard me, but when they are faced in a similar situation, they just go, I don't know, they just lose all sense of direction. So she said, we can't tell them. Abroad, I think is very different. In the US, they sit you down, you have counselors, they tell you both sides of the story. They say, agar ye radiation ho raha hai, to iske ye after effects hai, aapko ye. So there's a different level of intellect functioning. And I think perhaps they are obligated to tell you by medical. I mean, I'm just using, I don't know much of that. But here she clearly told me, she said, we can't do it. वो तो डर के सारे ही भाग जाएंगे. वो तो पहले ही भाग जाएंगे. I brought this topic. I said, आप पहले बताओ. And the same thing goes for even for my own mastectomy. And पहले मुझे बताओ ना, मुझे क्या होगा, मेरे आर्म को क्या होगा, then I'll take a decision. But they didn't tell me. I mean, they don't tell you what's going to happen later. They never tell you in India. That's what I think personally.
Yeah,
Because I think,
I believe because of the incidents that are going on, like, people blaming the doctors, or they might be feeling insecure at times that पता नहीं फिर बाद में मेरे पे सब, I might be blamed, and people beating up doctors and all is going on. I just a thought.
yeah,
Yes.
quite possible, quite possible. It's quite possible, Mehul, but I think now I don't bother much about it. But at that stage, I think Anagha has brought out a very relevant. I did go through that. That पहले बोल तो दो, भाई ये से इससे ये होगा, इससे ये होगा. So I am left with a choice. You know, I mean the choices are mine, and perhaps they need to do it even at the mid level, even at the lower end level. उनको सब, at least then only they will also rise, na? Maybe not today, maybe after 20, 30 years. Otherwise, just to gloss over something, it's a little difficult. There, I think abroad they tell you.
Actually, also because they are afraid of getting sued. So while Mehul is saying that,
Why would they get afraid to get sued, Anaga? I really don't understand.
the doctors, if they are not explain, so the obligation is with the patient. Whatever treatment is given, the patient has to accept it. If the doctor has not explained anything to it, and the patient sues the hospital and the provider, I mean, that's a much larger problem for them to solve, because at least in the US, people are like, it's a system that is very dependent on these class suits and all of these actions, right? So that's why the doctors make sure that they follow everything to the T. It's just,
Yes,
that's a
yes, I
defense
get your point.
mechanism as well for them.
Yeah. Here, it's a kind of a healer touch. You've come to me, I'll heal you.
Yeah.
You know what I mean? It's more of, I think Andy Singh had written some message. I don't know.
Yeah, let me check the chat. Yeah, and he says that, yeah, he thinks that it's also that the patient might back out, and so they might not,
Yes.
like you
yes,
said
yes,
earlier. Yeah.
yes,
Yeah,
yes.
and I think that could be one of the main reason as well. There is a lot of competition with doctors going on as well, from what I know.
I think it's also I found my team was, I have a lot of people who tell me doctors are money making, doctors are this. मुझे अच्छा नहीं लगता है Bengal जब ये बोलते हैं सब.
Everyone is
So,
not the same, yeah, but there are some
like,
odd people.
yeah.
Yeah.
It's okay. I mean, you've gone to them. They're there to tell you to do the test. सब कर लो ना. Test बिना test के वो क्या बताएंगे आपको? So,
Yeah.
ठीक है. And only वो test देख के आपको फिर बताएंगे. So the same thing. I mean, it happened to me, but then a lot of some of people I know don't know. ने ये उसने ये बोला. It's just random talks. I think that random talk goes on more in Eastern countries than
Yeah.
I don't know, possibly than in the West.
I would like to go back to Alisha's one of the first question, which she asked, like how she could respond to a person fighting cancer or diagnosed with cancer, or not make them feel that they are being pitied on. Alisha, you there? Can you hear me?
Yes, so thank you for adding to it.
No. So from
Please
my
go on.
experience, like as a cancer survivor, like I too lost many friends, and I believe it's a most common thing that happens to all the patients and their friends and the people around them, because it's new. first thing, it's new for the cancer patient that he or she is diagnosed with cancer, and they don't know what in the world they're going to do next. Because they think the same way the other people think, like cancer means death, which is not true. And the people around them who want to reach out to them hesitate, like if they say something, they might be taken in the wrong way. Also, whatever they are also not sure like how to react. So that is one thing. So from my experience, I would say that just be normal like you are with your friend, and just say that it's not a big deal, even though it is. But give some good examples. Say that be honest first thing, that you don't know how to react, but you want to be there for her
Yeah.
or him, and open up. That person might feel take some time to absorb all what you said, but in a day or two, that person will come back to you, and I'm sure that, because I had friends who I lost for forever, and I have friends who are great friends now because they were there with me during my fight. So it takes some time. Give them some time to overcome their thoughts first, and then they will start thinking about you. So just be honest is what I would say. Just be honest.
And also ask that, can I help you? Would you
Yeah.
like to talk about it? Can I come over? Would you like to come over? Can we go out for a coffee? Make it tangible. Don't say, "Kaise ho?" It's like something floating in the air. Kaise ho? So it's like, make it very tangible, make it personal, make it solid. Do something. Go there. I mean, I had friends who sent over food. I must say, when during the days of COVID, there was a stress at home on home staff. There were people who sent, my family sent, my brothers sent, my friends sent. I'm deeply grateful for that. They all chipped in. Acha, tu ye kha le, tu wo kha le, tu aise kha le. So people do send. They have different modes. Somebody wants to talk, or just pick up the phone and say, but ask, Alicia. Maybe you could ask. I think a good way to say is to ask. And a lot of people huddle into their families. Indians tend to, the family becomes a structure for sort of like, it becomes your full cloud. It becomes your umbrella. So they don't like to tell. They don't tell you if they've had a heart attack also. Kuch nahi hai, sab theek hai. So it's the fact of being less open.
Yeah, anyone in the group like who are still there, like if they want to talk something or share their experience or ask any questions to Rupa ji, please before we wind up, feel free to unmute yourself and talk. Just it's like anything.
Hi, can I come in?
Yeah, definitely, Shailendra.
Okay,
Please.
okay. I just wanted to add on the point of the fear of getting sued in US. I am in Canada. Same thing here. But I also wear another hat, and that is of a medical malpractice lawyer. I am a personal injury lawyer, also a medical malpractice lawyer. I'm a patient also. There is a different situation. I don't think that is the fear for educating people. There's a culture of fear of getting sued is little different. That is where the breach of standard of care comes in, because there are standards set up for everything. Whether you go to an ER, a radiologist does the interpretation of your scan and reports it. The surgeon has to also follow certain protocols. So there are protocols, medical protocols for most of the things are set up in the system. And that is what we call standard of care.
Mm-hmm.
So that is always, all doctors for that matter would be concerned about following them and not being falling afoul of any of them, not following them and then getting sued. That happens when you are doing a procedure, for example. You have to count all the instruments, make sure you don't leave a scissor inside, and when you close up the abdomen. So those things are there. But when it comes to education, I believe the system here in the West, I believe I'm speaking from Canada, but US would be very similar. and especially and similarly Europe also, UK also, those places, that there is something called informed consent. The consent, yes, we have to take consent of the patient. Patient has to consent, and that, by the way, that also becomes part of my profession sometimes when the patients have given consent, but then later on they say my consent was, yes, I was not explained anything.
Yeah.
I was given a paper to sign, I signed it. So unless it is an informed consent, so that is why a lot of times now when they take consent, it is not just one signature. There are a number of signatures to each statement. That you understood this, you understood this, you understood this, and then finally the signature at the bottom. So informed consent is, one is the legal aspect of it. They want to cover their back. They don't want to be blamed for not informing properly the patient. But the other thing is there's a culture also. People, like this is education. If you are getting into something, patient and doctors, they are collaborators. They're partners. They work as partners in the care of that patient. It is not just an approach. In fact, I can tell you there is a book by Dr. David Eggers. Dr. David Eggers, he is an oncologist in US. He has written a book by the name of The End of Illness. Now, The End of Illness, that is a rhetorical title of the book, which, by the way, was given by Steve Jobs. Steve Jobs was one of his patients. So then Dr. David Eggers wrote a book on that. And in that book, he speaks about that you should be, as a patient, should feel free to ask questions of your doctor. Gone are the days when doctors would be speaking from a position of authority and dictating terms to their patient. No more.
Right.
And if you are afraid of asking questions to your doctor, change your doctor. In fact, very similar statement was made by my oncologist last year. Now you see another thing. So my oncologist is actually I was referred to him, but actually normally I am seen by another oncologist in his team. But this main oncologist, last year, he spoke in a conference. That conference was of the patient support group. So I have a cancer by the name of GIST. It is called gastrointestinal stromal tumor. So there is a organization in US, and it has branches in Canada also and other places in the world. It's called Life Raft Group. So if you can look it up sometime, Life Raft Group is dedicated to GIST cancer. So they hold conferences from time to time in different places. So last year they held a conference for Canada in Toronto. This year they held it in Calgary. I couldn't go there. So this was last year I was fortunate, and it just so happened before my surgery. So here I was in the treatment of that same doctor. And here in about 6 months' time, and just 2 months before my own surgery, this doctor happens to speak in that conference. And during that conference, he is educating. And whom is he educating? He is educating the patients. Everybody else in the audience is patients. Not all of them was his patient. Matter of chance, I was part of those small number who were his patient or his team's patient. But he was speaking generally, and that was recorded also. I don't think that particular one was recorded, maybe, but a lot of times they are recorded and they are put on YouTube, like the one we are doing here today. So education. Patients need to be educated. Now, it's a different thing that some patients are not sophisticated enough to be educated. Fair enough, that's possible. But even then, doctors need to come to their level as much as possible and try to explain to them. But at the end of the day, the patients have to carry this cross of treatment, the side effects, and anything else going down the road in terms of outcomes. So in India, I have been on both sides. So I've been in India also. I came here only at the age of 42. My brother happens to be a doctor. I have other people in my extended family who are doctors, so I know that culture, and I have used Indian healthcare system extensively as well as here also. So the difference is because of somehow there is a still that the Dr. David Ager spoke about. I think that was also here at one point, which we have in the West kind of grown out of it and come to a stage where we now believe in partnership between the doctors and the patients. In India, it is still like, pudiya wala system, when you doctors, like Hakim ne pudiya di aur aapne kha li. You don't know what is there in that pudiya. In fact, that reminds me some people who are being not authentic Hakims. There are some authentic Hakims also. They give real good pudiyas. But there were some others who were kind of putting steroids in their pudiyas and giving to their patient, and patient will feel good immediately and say, oh, but you don't know what has gone into it. Whether somebody is manipulating you, putting some steroid in your pudiya or not. So in the West or in the allopathic system generally, we know what we are taking. If I'm
Yes.
getting instant relief through steroid, I know it is just a temporary relief. I got it through steroid. It is no magic in itself. So that was my point, because since it was mentioned about Naga has mentioned this point of medical malpractice part of it, I just stepped in to say that, share my thoughts on that. I'm
It's
sorry,
very
I think I
no,
took a little
no,
longer to
not at
speak.
all. It's very interesting you brought that up, Shailendraji, because that pudiya system actually, India, we have a lot of population which is uneducated. They don't know. They don't have healthcare systems here enough. So वो जाते हैं बेचारे लाइनों में, क्या दिया है भाई, पता नहीं, मुझे दवाई दे दी, क्या दवाई का नाम है मालूम नहीं. I
Yeah,
face it every day, so what it's very difficult. India is a very different. I think where the patient is educated, there is a partnership. Where there isn't, I suppose there is an underlying partnership. जैसे पुड़िया दे दो, खा लोगे, ठीक हो जाएगा, क्या करो?
yeah. I would like to add to this. I'm sorry this is being going on, but I'm enjoying talking to you all. So one more thing that I've noticed in my past 10 years after my cancer was there, and I've spoken to thousands of survivors and even educated, like it's not just uneducated, it's educated people who would trust more people they know than unknown people. Unknown people, I mean doctors. Known
Yes.
people, I mean वो कहीं से मेरे चाचा को ये हुआ था, वो उधर गया, वो ठीक हो गया. So I will trust that guy because he told me. It's like that. So that is a mindset that is very so. But I always, when you ask questions, you ask for proof. If we Indians go to buy vegetable at a small vendor, we will see 4 different places to buy one kind of पाव किलो का कुछ लेना है तो. लेकिन अपने लाइफ का सवाल आता है that we don't go and check 4 people, right? 4 doctors. So that I see that people don't, the trust issue is there that kills them, I think, because they don't trust the doctor. They'll try to listen to other people's story without even rectifying if it's really true, and then it's too late. I've seen many people pass away because of the stupid mistakes they make, unfortunately.
You're true. You're right.
Interesting. I think we can have an open session next time also. Now,
Yeah,
whenever
I would
whenever
always
you
love.
fall short of a patient story, you can all. I think it's very interesting to have an open session and just see what people come up with.
Yeah,
So
definitely.
that's
I think we'll
great.
make a.
Yeah, I think we need to close up now.
Yeah, and I think we'll make a post quite early so that we can circulate it among people we know, and we can have more people who can talk on this on we all come from different areas and different point of views and different experiences. If we put to all this together, like Alisha is learning from our talk, so maybe this insights she might not receive from others, or she might just receive half of that information, but all the information put into one pot, and then you can take it like the way you like. But I definitely would plan to have kind of a general
So
discussion.
one thing,
Yeah.
sorry to interrupt. So like, am I allowed to take notes from these sessions? Because I'm getting a lot of relevant points from here.
Of course you are.
Anisha, so and you don't need to take notes, okay? This is a recorded session. We have I don't know if you're a member of our group, Cancer Survivors in India. We have a YouTube channel. All our videos we post onto this YouTube. So it's open. You can watch it again and again. You can share it with people you want, you think may help. And this is just this group is here to spread the uh, right information, and to want people to talk more on cancer. Like, it's not we are all have been through, and we don't want people to suffer what we did go through. And so that's it. So this is a recorded session. You can make notes, you can share the recording, and you can, like, yeah, if anyone is going to get help from this, we would be more than happy to do that.
All right. So thank you so much.
One thing I will do. Sorry, Alicia. For the benefit of Alicia and everybody else, I just referred to Dr. Agus's book.
Yeah.
So I had taken out some excerpts from that book. I typed them myself, relevant portions which I found very interesting for general benefit. So I have those saved with me. What I will do is in today's in the Facebook post of this of this discussion, when we have this Zoom meeting, we have a Facebook post on this. So in the comment section, I will just post those comments, those excerpts of that book.
I think that would be interesting. Now,
Yeah,
Mehul, is that allowed? That's allowed now.
Yeah, definitely.
Sorry?
Anything that is
it's only comment. I mean, I have written
No,
it
I'm
myself.
just joking with Mehul, because everything you have to ask him, you're allowed again.
Yeah, one thing.
That is right. I'm sorry, but yeah, sorry, go ahead. I'll talk after Shailendra.
Yeah, you can talk about that, but mine is only a comment form. It is excerpts of the typed.
Yes.
It is not any link or anything.
No, I think we will all learn from those excerpts. And if you could also write the name of the book and the author,
It is mentioned there. Everything is mentioned in that small write-up. I excerpts of that book only, and I've written page number this.
All right.
What Dr. Eger said there. So I've given that, and then that would be beneficial. And if you like to buy that book and read it, that is further thing you can do.
That would be nice.
So can you please repeat that the name of that book you were talking about, David Egler's? What was the name, sir?
David Agus, Agus.
Okay. So name of the book?
The End of Illness.
Yeah, Krishna just put it in the chat. Yeah.
But I will put it in today's the post of the Zoom meeting. Today's the post or the post that was posted a couple of days back.
Yeah.
So I will just put it there.
Yeah, the reason I am so strict about posts in this group, just to make it clear, because if even if you are putting the right thing and it is helpful, then other people come up कि उनको तुमने ये post करने दिया, हमको क्यों नहीं करने दे रहे, तो वो that becomes a problem, and we've experienced that. So people like, DM me, reach out to me. We want open discussion because we want to verify what people are talking, giving the right information and all. And we have tried to keep this group out from false people like vendors trying to sell things, or marketing people. So you won't find those people in this group. So anything no wrong intentions for anyone, but we just want to verify that it is the right thing. And once, like, now I know Shailendra ji, now I know Rupa ji, and we are like 4-5 admins. If we know each other, we know, okay, they are going to do the right thing. So next time we don't have to verify that. But sometimes there are people who come out like, you let them put that and you're not letting me put this, and then it becomes difficult. So we just try to do our best. But again, Alicia, yes, I just put in the link for the YouTube channel. If you're not in the group, feel free to join it. And yeah, I would just like to take one more minute, Rupaji. I know you're very tired. Let me share my and I'm going to give you a small token for spending your time with us. One moment.
अरे क्या token? What is this now, Mehul?
अरे कुछ दिख नहीं रहा है क्या? एक मिनट. Yeah. All right. Okay. So.
Oh, nice. So lovely. Wow.
Yeah. So thank you. You feel free to post this in your
I will.
and all. And we want.
And वो मेहुल वो जरा recording सुन के दे देना, कुछ absurd comments जरा delete कर देना.
नहीं कोई absurd comment नहीं है,
but politically incorrect statements.
No, don't worry. And I'll go through it again. And कोई नहीं, हम लोग हैं ना आपके साथ. क्यों आप टेंशन लें? All right, I think let's wrap up, and we will look out for something new again, some new person to talk to, and definitely Rupa ji will have a discussion on having an open session on and get in a topic in that. And
Yes.
well, thank you everybody. Thank you so much for your time, and it was always great to see you all and talk. Um, and like 1 minute, I just got a message. Please share I just shared the YouTube link below your earlier comment. I don't know your name, Zayomi, but I'll also share the FB page while you're here. One moment.
I think she's just asking to share
Priya.
the page. She'll do any.
Yeah, Krishna did. So to join the group again, strict rules. You'll have to answer all the questions honestly. We'll verify them and then add whoever wants to come in. All right, and yeah, Rupaji, thank you again for your time.
Thank you so much for having me. It was wonderful meeting all of you.
Absolutely.
Thank you.
Thank you, ma'am. Thank
And
you,
thank
everyone.
you, Anaga. I'm coming to Ohio.
Please welcome. Now you know Annagal, okay? So you can directly
Yes.
call.
And no getting into the kitchen for all of us.
No, but you know what? Mehul makes excellent chai. So I think we should that rule shouldn't apply to Mehul. So
Okay,
We'll send him to make chai.
Just before leaving, let me share a joke so that everyone goes with the laughing. So हमारी शादी हुई, yeah, हमारा love marriage है. We were in the like this, and then she never had tea when she was young, and I'm from a Guju family, so चाय तो मतलब बर्तन होता ही है. तो शादी के बाद मैं बोला चलो चाय बनाओ, तो बोले आती नहीं चाय बनाने. बोले ठीक है मैं बनाता हूँ, सिखाता हूँ. तो मैंने चाय बनाई फर्स्ट टाइम, तो उसने दी, बोली बस तू ही बना अभी. तो आई डोंट नो हाउ मेनी इयर्स, like 20+ आई एम मेकिंग टी एवरी डे. एंड टू पनिश मी व्हाट शी डज इज लाइक, अगर कोई गेस्ट आता है, मेहुल बहुत अच्छा चाय बनाता है. And
Acha.
I cannot.
want to share my blessings.
I know. One more question, Shailendra ji. Which part of Canada are you in?
I'm in Toronto.
Okay. I have a daughter in Calgary. That's why the question.
Oh, I see. Okay.
Okay. All right.
No, but ask her to connect with me. I mean,
I will.
yeah,
Thank you so much.
yeah, sure.
Thank
All
you,
right.
Mehul.